Hi everyone, Vicki Laughlin here with Dynamic Wellness. Welcome today on this little episode of my little mini podcast, unofficial podcast. I'm calling this Healing Our Bodies with Natural Therapies. And first of all, a little introduction on me in case you don't know who I am. I've been in the health and fitness world and field for about 40 years, actually exactly 40 years. I started off as a bebopping aerobics instructor, and I've worked my way all the way up through about 11, 12 years ago, I became a holistic health coach. And so that combined with my exercise coaching. And that's what I bring to my clients today. Probably the focus there has always been, I've always felt that the body could heal itself. I kind of learned that from my mom without realizing it. I'm sure she didn't realize she was teaching that to me, but she never rushed us off to the doctor. I don't think I had an antibiotic until I was an adult and had adult acne, which I can tell you why I had adult acne and how I could have cured it naturally without an antibiotic, which I've done because it doesn't reoccur. But so I got to enter my adulthood with very little of that insult on my body, the antibiotic insult, and just letting the body take, let nature take its course and heal itself. And so I met this amazing woman, Dr. Layla. She's a chiropractor, and I wanted to have a conversation with her about this very topic, but in terms of chiropractic. So we have Dr. Layla here of Vitality Medical Center in Tustin, California. Dr. Layla's mission is to help as many people as possible to have quality of life through good health in the Orange County area. She specializes in physical medicine and rehabilitation, as well as regenerative medicine that is evidence-based and natural. She's a graduate of the Cleveland Chiropractic College in LA. And when you start working with her, she will say, the meaning of doctor is teacher. And she likes educating her patients so that they can take responsibility for their own health. And where that resonates so much with me is in my holistic health community, our motto is the doctor of the future is the patient. And we have to learn how to tune into our bodies when something's not right, and not necessarily always run off for some medicine for that, or learn what natural healing modalities there are out there to get the body better. So I'll let Dr. Layla elaborate on her experience and all of that. And Dr. Layla.
Sure. Hi, everyone. Absolutely. When I have my report of findings and I go over the x-rays and the exam findings and I recommend a treatment plan for my patients, I actually tell them, what are you here for? Are you here for pain relief? Are you here for correction? Are you here to learn about how you can be your own best doctor? We can train you and teach you a lot of the things that you're going to not only do now, but probably will have to continue doing for the rest of your life, just to make sure that you're always staying responsible for your own health and do the things that you need to do to strengthen, to lengthen, to always maintain and be in a place where you're just thriving and always keeping yourself well. So we can teach you those things. If you're here for a quickie just to kind of get rid of pain, the pain will be gone, but it will not stay gone. Most commonly, those pains that will return and you'll be in the same condition, or your body will compensate and use another area. And meanwhile, that other area that initially gave you a signal to do something about it, and now that area is not giving you a signal anymore, and it's just fusing, or it's degenerating, or it's atrophying, or it's causing dysfunction of a nerve that's traveling through that segment to go to an organ, and it's compromising the organ. So it's all about wellness. It's about communication. It's about, why is the spine any different than the teeth or the eyes? We go for regular checkups for the eyes and go regular cleaning for the teeth, and even our cars get regular maintenance. Our hair gets regular, maintenance. Why not the spine? Some people think their motto is that if it's not broken, then don't fix it, but it might be broken. It's just not giving you any symptoms right now, and it could be really a problem later in life, giving you the not very good quality of life and debilitating pain, which ends up being a surgical case. And there's a diagnosis for failed back surgery. 67% of the times back surgery fail, and that's because they didn't need the surgery in the first place, or the pain wasn't necessarily coming from that segment that shows on the MRI that it is a herniated disc, or whatever the case might be. Sometimes it's the supporting structures. The supporting structures are the ligaments, the tendons, the muscles. Everything is supporting the disc and the joint, because the disc provides the space for that nerve to travel from the spine to go to different parts of the body and control those areas, including the organs. So if one thing goes, they all go. So it's really important that we address the muscular issue, the structural issue, but first just diagnosing correctly by looking at the whole body, not just one small little part. Because
we're going to get into that in a second. And I love your analogy about how people take better care of their cars than they do sometimes their bodies. And I think about that too, when people don't want to buy the healthiest food possible, maybe don't want to, maybe they can't afford to. There's always an alternative to helping that person. But yeah, I mean, it goes back to health is an investment. Health is wealth.
As well.
Yeah. So what got you into chiropractic?
Well, I had an injury myself, and I couldn't walk. I was at a big campus in college, and I had to walk with crutches, and it was going on for a long time. I did PT, I did acupuncture, I did everything, and nothing helped until I went to see a chiropractor. And he did some ultrasound on my foot, but he also took x-rays of my back. And I was wondering why, because my pain was only in my foot. And when he explained that the nerves, the nervous system, the nerves travels between the spinal bones, and they can travel, the nerves that leave from the back control the feet. So if you have a bone that's out of alignment in the spine, in the lower back, it could be actually causing the pain in the foot. So no matter how much you address the foot, if you don't address the back, you're not really fixing the cause, you're just treating the symptoms.
Yeah, right. And so that resolved your issue, and that got you into chiropractic school, right?
Absolutely. That's when, well, I had initially wanted to go to dental school, and then things happened, and I was intrigued so much about chiropractic, and it came into my life several times. So I realized this is my mission, and I need to go into this field. And I really love what I do, and I love educating so that patients are their own best doctors. Mm-hmm. And that's why I spent a whole hour on the first day and the whole hour on the second visit when I go over the findings, because I really want patients to understand why they're having the issues that they're having, what can be done to correct it. And and so it's important that they know these things, because otherwise I'm just putting a Band-Aid and just giving them temporary relief and not really fixing things for the long haul to help them in the future.
Right. And that's, yeah. Well, I have my own story of how I met Dr. Layla. She's pretty prevalent out there on social media. And if you're local to this area, you may have, depending on what your demographics are on your social media. But her thing came up, and I saw her adjusting somebody, and I don't know, I switched screens and then came back. I wanted to find her again, and the universe helped me out there. It happened a few days later. But what was happening to me probably over a year ago, and I have a history of carpal tunnel overuse, although I know now it had a lot to do with my gluten exposure. And in conjunction with avoiding gluten, as well as uh, re adding nutrients back to my body that were depleted, that I learned about through a micronutrient test. Between those two things, everything was getting better. But then all of a sudden, this finger would get locked down. And I honestly, it was like, okay, I went and I did massage. I have a massage therapist. I did that. I'm also a massage therapist, so I'd work on myself. I went to acupuncture because originally when I had an issue, that helped me a lot. And I was just noticing when I would work with clients and, move my head around, it's like my neck's stiffer than normal, And then this thing came up on social media. There was Dr. Layla, and I went, I need to go see her. She's like, who's going to help me? That's just what I felt intuitively. And when I found her and I scheduled the assessment, I had my x-rays done and I paid extra so I could get the whole spine. I've never had an x-ray on my body like that. So she found that so another thing with the history is I've dislocated the shoulder about a dozen times. Between that and the carpal tunnel and everything else, it's kind of like my right hand, but I was losing strength. It was bad. It was like, I got to do something because I'm not going to live like this. And I know my body is not breaking down. It's going to heal. I just had that belief. Well, what Dr. Layla found is, and she probably explained it better, but my cervical spine was straightening and fusing. And as soon as I went through the regular adjustments, I want to say by week 2 or 3, the trigger finger was resolved. And I've gradually gotten back some strength in my hand. I can lift the things I couldn't before that were heavy. And so, voila, I just believed it, and I wasn't going to stop searching, and unfortunately, chiropractic was never always my first go-to, but now it's going to always be part of my health regimen because it's so, so critical. And so I thank Dr. Layla for that. She's the best.
Thank you, Vicki.
You're
Thank you. I
welcome.
mean, it's so important that a lot of people just don't realize the importance of freeing up your nerves. And you might not even get pain in an area where you might have compression of a nerve. And it's just a reduced signal, just like you would not have a good cellular signal. That organ is not getting the signal that it needs. And then we start to have digestive health issues, or thyroid, or, various different parts of the body, or not being able to conceive. And so people don't realize that it is not necessarily that particular organ that's not necessarily functioning optimally, but it's the fact that there's a compressed nerve. And if we can free up that nerve, that organ can function at a higher level. And that's what you want. You want optimal health. We work so hard through exercise, good nutrition, we do all the right things. But if you're not really, a lot of times people think that it's just for back pain. And yes, science and has proven over and over again that chiropractic adjustments help with back pain. But you have to understand why it helps with back pain, because it relieves the nerves, just like it would relieve the nerve that is compressed, that's not giving proper signals to the digestive system, causing indigestion, heartburn, acid reflux.
Right.
So it's kind of cool. Yeah, definitely.
Tell us, quickly about your evaluation process, because I'll tell you that was a real winner for me because of what I do. And I know I don't guess, I assess so that I know how to work with the client. And Dr. Layla's assessment was so incredibly comprehensive. It was really that was my grabber right there. So tell us what you do.
Thank you, Vicki. I do get a lot of patients indicating that we call it a day 1 and a day 2 is very thorough and very detailed. So we do a comprehensive evaluation. We do orthopedic tests. We do a foot scan. We do muscle testing. We do range of motion testing. I check for pliability of muscle tone. I palpate the spine to see where the segments of the spine is restricted and tight and lacking motion. And therefore we call that a subluxation, which is a vertebral misalignment of a spinal bone that's interfering with the nerve and causing dysfunction. So, and then we do x-rays. So of course we do x-rays of the region that is compromised, but sometimes it could be the thoracic spine that's causing the lower back issues. So we really need to look and see how the thoracic is affecting, for example, the lower back, or how the thoracic is affecting the neck, because it's all connected. And so we want to really see where the problems are coming from, because you could have a leg discrepancy and rotation on your pelvis that's causing your shoulders to kind of twist forward, and there's a misalignment there. So we like to see a full spine x-ray. So after that, we review the x-rays, we make some lines on the x-rays, and we sit down with the patient right here in this room, and we go over all the findings of the foot scan and the x-rays and the exam findings and the history of the patient. And from the history alone, we can get the diagnosis, but we like to take it further and be detailed and show the patient the x-rays and let them know what the diagnosis is and what our findings are, what our recommendations are. And the recommendations are not necessarily just chiropractic, because we're an integrative practice. I've realized over the years that patients, they don't just need adjustments. Sometimes they just need muscle work, or the combination of both, because it is a musculoskeletal condition housing your nerves. So without the nerves being involved, you wouldn't have pain. So just addressing the spine, or just addressing the muscles, then you're just doing half the work. And because we have a medical provider who does trigger point injections with PRP, which is your own plasma, the results are phenomenal. And maybe that might not be the case for everyone, but whoever could be a good candidate for pain management or PRP injections to help regenerate new tissue and to break down the trigger points and make them smaller, allowing the muscles to have a better isometric contraction, then yes, the muscle is going to respond really well. The spine is going to respond well. And then, of course, the foundation, which is the feet, we need to really address that, because just like the foundation of a house, if it's not really solid and stable, the house is not going to be stable. And our feet is our foundation. And a lot of people have problems with their feet that results in a weakened stance and posture. So we really address the feet, we address and everything from head to toe, pretty much.
Yeah. And you pointed out some things with my feet. I actually used to have high arches, and because I've been doing a considerable amount of barefoot training when I exercise, I also had significant pain in my feet that is gone, completely eliminated. But I've started to pronate, so I've kind of overcorrected the high arch. I'm going the other way, but just you pointing out how I can adjust the weight of my stance, those are the things. Not everybody's going to be like me, because I take a lot of my therapy onto myself, because I know what to do. I know the body. And all you have to do is explain to me what I need, and then I take care of it from there. So, yeah, I do have arch supports. I wear in my hiking boots and wear with some shoes, especially when I'm hiking, backpacking, because of the heavy pack. I do keep it in there, and that helps a lot. But again, I used to do that even with the arch supports and have considerable pain in my feet at the end of the day. I don't anymore. And that's part of that has been adjusting, elevating my nutrient levels, addressing what was deficient. And it's a whole, it's full spectrum. It's everything. But what I really love is how you explain the reason why we want to continue chiropractic, not just because you're in pain, but as a wellness, as part of your wellness protocol, and the fluidity and fluid through the spine, and how that keeps us healthy from a very natural perspective. Can you explain that?
Absolutely. Well, like I said, there is 90% of the time we don't have pain. The body doesn't give us necessarily pain, but only 10% of the time it gives you pain. So then other 90%, you could have a misalignment of a spinal bone that's interfering with the nerve and its communication to any of your organs, including your immune system. We have 10,000 cancer cells that gets produced in our body every month. And every month, our immune system, which is controlled by our nervous system, allows the T fighter cells to find those cancer cells and destroy them month after month after month. Now, if our immune system is weakened, then obviously those cancer cells are not identified and destroyed every month, as well as allowing our body to have infections, as well as our bodies to get sick regularly. We just don't have that strong immune system. And so it's really important for that nervous system to communicate with the immune system and all the other organs of the body as well. And it does so a better job when you're in proper alignment and you don't have misalignments that are not necessarily giving you pain, but restriction, tightness, bad posture, any of those are bad symptoms. Those are symptoms as well. Just tightness of muscles is a symptom indicating that you have lack of motion. And lack of motion doesn't necessarily just come from the muscle. It also comes from lack of motion within the joint. If the joint is restricted, it will give you lack of motion. And that tells you right there that the nerve can be compressed, not properly communicating with the organs and causing dysfunction. By the time you have it show up in a blood test, it's already well advanced and the organ's already damaged. Like, for example, a gallbladder that's full of stones. I mean, the gallbladder didn't get stones overnight.
Exactly.
It's been like that for a long time. And you never really knew until you had a gallbladder attack or an infection. And then they're like, oh, you have to remove your gallbladder. But it's been there for a while. And so mostly people would exhibit really tight muscles in the upper back. And that's an indication that, there's lack of blood flow, lack of nutrients to the tissues of the spine and the soft tissue around the spine. So then therefore, what happens if you don't eat? What about if you don't get nutrients for about 6 months? Will you atrophy? Will you degenerate? Will you perish? Yes. Same thing is happening to the spine and all the associated structures along the spine. And essentially that allows early degeneration, arthritis, and therefore loss of spacing where the nerves are traveling from, and therefore more compression and more dysfunction of the organ and systems of the body.
Yeah, I hear you. And I am all for chiropractic, like massage, being part of my regular wellness regimen. And I'm going to continue seeing you for sure.
Okay.
So how's everybody? I mean,
longevity, quality of life.
Exactly. And I preach it. This is who I am. It's, as a coach, and I'm always looking for the best way to naturally heal. And this is one of those ways. So
Me too.
why don't you give us your social media handles, and then in the comments, I'll put down your contact information for anybody who wants to come see you.
Awesome. Very good. Thank you so much, Vicki. Thank you for having me. I really enjoyed, I get really passionate and excited about chiropractic, about just overall this type of healthcare, natural healing, holistic healing. I'm very much about getting our westernized tests and getting checked out. I'm all about westernized. I have great respect for westernized medicine, as long as we're not over medicating and we take that approach to make sure that we get checked every year. We do our exams every year. We can't just completely not go that route either. It's important to get all those tests. And then, of course, taking the more natural approach would be to do things first before starting to take that medication. My handle on social media, I believe I have a couple. One that is for the office more so is for Dr. Layla, DR, and then LAILA _ NM. And my other one is called Bodywork Doc. And that is
Facebook?
On social media, both social media. And I believe on Facebook too, it's Dr. Layla _ NM. And it's Vitality Medical Center in Old Town Tustin, right next to Rue de Bigorre's restaurant.
Yep. In the little Old Town area there, which is cute. Okay, great. I know you have a patient you have to get to, so we might chat again. You might see Dr. Layla and I chatting up again. But thank you so much for today.
I'm excited.
And
you're welcome. Thank you.
You're welcome. And I'll be seeing you probably next week.
Looking forward to it. Have a great one.
Okay,
Bye, guys.
bye-bye.